those on a collapsed child. And there's two considerations here. First of all, with the bag mask, we're actually going to take the adult mask off and we're going to switch it to a child mask. Right? So that's how the bag masks are configured over at Starship. They use an adult bag and that just pulls off there, Teresa, just a straight pull apart. And if you want to connect the paediatric mask, right? So that's the first thing that we require. The other thing that is different is the compression to ventilation ratio. In a healthcare setting, it's officially 15 to 2. The rationale for that is because children generally have a breathing problem, with 15 to 2 you deliver double the number of ventilations. Now there's no clinical evidence that 15 to 2 is any better than 30 to 2, right? So if you do 30 to 2 on an infant or a child, it doesn't actually impact on their survival, right? But like I said before, we're bound to teach you what the Resus Council say, and they say 15 to 2 for people working in a healthcare setting. Now as far as the AED is concerned, these AEDs here are equipped with paediatric pads, typically for defibrillators in the community who do not find paediatric pads, all right? And the key difference is they're smaller in size, and you'll see on these pictures here, notice the pad placement is one front and one back. And they have these over in Starship Hospital. Basically what they do is that they deliver a smaller amount of energy, all right? Now, if all we have are the adult pads in a community type setting, then we must use them, all right? Because if the patient's lying there in cardiac arrest, they can't get any sicker, and you can't leave a perfectly good defibrillator lying next to somebody when they may be in a shockable rhythm. You don't know that that child hasn't got a congenital heart defect. You don't know that this isn't as a result necessarily of electrocution, right? So if we don't have the specialised paediatric pads, then the recommendation would be to simply get the adult pads.
Using the same one?
Exactly. We call this making a heart sandwich. So I just peel any pad off, it doesn't matter. And I go one there, and then I roll the patient over, and I go boom.
Oh, you don't use them like the stickers then, you use it like...
Look, depends on the size of the child, right? And again, your pad system is a little bit different on your AED because it is joint, but
you can take them off.
You
can. They're on a Velcro.
Yeah. The problem is if you have anything to do with health and there's an emergency, because I get this with the dentist I train and all sorts of people coming through the front door, right? So what you would do is your hands are actually quite a good approximation for the size of a defib pad. If you say to yourself, I think those pads are going to be too close or they're going to overlap, we need to do what I call making a heart sandwich. In other words, the two pads are your two pieces of bread, one front, one back. Which one you choose for the front and which one you choose for the back makes no difference at all, right? But on an older, bigger child, you'd simply put the pads on as per normal, right? Now, you can't put the pads on here without interrupting CPR. So in these next two scenarios, when we're going to use the child mannequin and the child mask, what you'll have to do is you'll have to say stop CPR, get those pads on front and back, and then back into